Welcome again, pre-Chiro students. This is Dr. Ben, your chiropractor, your pre-Chiro advocate, just having meaningful conversations with practicing chiropractors, people that have been in the profession for years and have some perspective to share. So today we have Dr. Arthur sharing with us. Dr. Arthur, can you just get us started by introducing yourself, sharing a little bit about what your background was before you went to chiropractic school and what attracted you to this profession?
Absolutely. Well, first off, Dr. Ben, thank you for having me. Definitely a pleasure and an honor to be aboard, and look forward to a great, successful podcast today. For those who don't know me, my name is Dr. Arthur Plesa. I am a 2008 graduate of Life University in Marietta, Georgia. So the other side of the continent from where Dr. Ben graduated. What got me into this profession? This was actually my third profession or third career of choice before I got into chiropractic. Right out of high school, I went into mechanical engineering. I had a little bit of a background into that going into it. And about a year or so after, I just kind of lost my interest into it. And then after that, my backup plan, if mechanical engineering didn't work, was clinical psychology. I spent a little bit of time into that and kind of lost my focus, my desire for it as well. And just when I was getting ready to move into something else, my father had pulled me to the side and asked me, said, "What do you know about chiropractic?" I said, "Well, not too much." I think I was about 22 years old at the time, 23. I said, "I know it helps people with neck and back issues, I guess. Why do you ask?" He says, "Well, what do you think about becoming a chiropractor and going to school for that?" And I said, "Well, I guess I can give it a try and see what it's all about." So my father and I actually went out to Life University. They had a kind of an opening right there for new students to come in and find out what it was about. The president at the time was kind of giving a speech and just introducing everybody to chiropractic, and I fell in love with it. I love the philosophy behind it, the innate intelligence, how it connects with the human body, and how us as chiropractors help that innate intelligence working within the human body. So that right there just really caught me off guard when I first heard that, because going into it, I thought it was really just a mechanistic, fix people's backs and necks, help them feel better. Nothing wrong with that. But when I found out there was something more behind it, that's really what got me turned on to this profession. And what really keeps my passion going for it on a daily basis, that we are working with an innate intelligence that works within this body, within the nervous system. And us as chiropractors, by keeping the spine clear of subluxation, allow that innate intelligence to keep the body healthy and alive. So when I caught on to that philosophy, that's really what got me enrolled into chiropractic school, fueled my fire throughout the 3.5, 4 years I was there, and absolutely love what I do today as a result of that.
Awesome. Can you talk about the application of that philosophy within your own practice? What kinds of ways are you communicating with people that message of the innate intelligence of the body and its relationship to the nervous system and vertebral subluxation? Can you just kind of expand the context a little bit on some of the topics and terms that you just touched on in today's current practice?
Absolutely, I'd love to. So in today's current practice, we have to remember that while we can talk about innate intelligence, you're not going to spend a 30-minute office visit giving a dissertation on, our theory of innate intelligence and how it connects with the human body through the nervous system. Your average patient coming in just wants to know if you can help them. How long is it going to take? How much is it going to cost? But to keep that patient moving forward in care, you've got to get beyond that physical and beyond that mechanistic approach as well, because you're only going to see them for a few visits if that's your only approach. So in regards towards connecting the philosophy of chiropractic to today's modern day practice, it is essential, but you have to learn how to boil it down to where it's digestible to your average patient coming in. So the average patient coming in I'm going to relate them to the way I was when I first got into this profession. They see it as a mechanistic approach towards helping symptoms. So we have to slowly change that approach, one visit at a time for the patient, and you can't do that all in one visit or in 2 visits. So you have to have strong procedure to move them through that. In chiropractic philosophy, what I love about it is it gets the patient turned on as well to find out that there is something more behind their symptom coming in. So the way we like to communicate them, and you can use the term innate intelligence. Something everybody's familiar with is the term life. Everybody knows they have life within them. So we just tell them that from those first few visits, we want to know first and foremost, subluxation is the cause of their problem. So we're going to go through a detailed examination in our office that uses paraspinal thermography to measure the heat given off by that subluxation, and then confirm which vertebra is causing that subluxation through X-ray analysis. So when we can show the patient those two objective tests, those two physical tests, it becomes a lot easier to let them know there's something behind the test. If we're not using objective tests, everything is just subjective in the office. While there may be validity to those testings, that's beyond the scope of today, but when we get to objective testing in chiropractic, that's where the average patient acts their problems to a cessation, right? And then from that point, we can start introducing the idea of innate intelligence, and that life is being blocked or dammed up by that subluxation in their spine, wherever it may be. So our goal as the chiropractor from visit to visit is to slowly get them transition, like the minute clock on our clock, right? It goes minute to minute as it goes around that clock. It doesn't go from 12 o'clock to 12:59 in 1 second. Our patients slowly have to be transitioned as well from that everyday mechanistic approach of relieving symptoms to finding out there is an innate intelligence within our body, and it's as a result of that subluxation, blind intelligence, electrical energy that it produces going through our spine that's causing those problems that they have, whether it may be pain all the way to chronic health problems that can interfere with the quality of their life.
Mm-hmm. Dr. Arthur, your message is really on point and clear, but the feed, and we can edit this part out, but I'm just curious, is there any applications also running on your phone or your computer that we can close out, or if we can set your phone to do not disturb? Because every other couple seconds there is some choppiness, at least on my end, which I imagine is going to show up on the edited version as well. So I'm just wondering if you can explore on your computer for a brief moment and just see if there's anything that can be canceled out.
This
so
off of my phone over
which is
here.
Actually,
I don't have any apps running.
Okay. No worries. It's happened in the past, and I apologize.
Give me just 1 second to make sure everything's good. Okay. I had Facebook Messenger up from when I had messaged you earlier. Maybe that was interfering with it, but hopefully we're up good now.
Possibly. I hope so. Yeah, no, that was really beautifully said, and I appreciate the clarity and the specificity in your message. And I'm wondering if you could touch on the thermography and the X-ray, specifically maybe the analysis, or just how that all works. If you could just introduce somebody who's completely brand new to the idea of using those tools to assess for subluxation.
Absolutely. Let's start off with the first objective test that was introduced into chiropractic. Back in 1910, B.J. Palmer, the developer of chiropractic, had introduced X-ray into the profession and was the first to do so. He had brought it over from Germany, which of course had just been developed about 15 years prior, and was the first person to X-ray the spine, and had changed terminology from X-raying to spinography, which is just a specific term or a specific X-ray of the spine. So the X-ray analysis that I've developed over the years of practice now is referred to as an articular model of analysis. So when we look at X-rays as a chiropractor, there's really two ways you can analyze them when we're talking about, let's say, upper cervical work, which is the type of chiropractic that I focus on. We have what are referred to as orthogonal subluxation models and articular subluxation models. The orthogonal models are going to be all of your orthogonal upper cervical techniques, so like your Atlas orthogonals, your advanced Atlas orthogonals, your NUCAs. Your articular techniques are going to pretty much be toggle, which is side posture, and then knee chest upper cervical, which is the technique that I focus on. So the articular model that I've worked and developed on over here was developed originally by B.J. Palmer. I kind of picked it up and just really focused onto it, developing it over hundreds of patients, basically confirming it with thermography afterwards, which we'll get into in just a moment here. But what we're looking at on the X-ray analysis, specifically in the upper cervical spine, is you're going to be looking at the relationship between Atlas and the occiput, which is the joint that will misalign during subluxation for an atlas subluxation. So we are specifically looking at that condyle lateral mass joint to make sure they line up on that A to P open mouth view. And we've got a few different ways of analyzing how it's going to shift from side to side. But in essence, the technique that I've developed, knee chest specific chiropractic, the X-ray analysis focuses exclusively on that articular model. So we're no longer going to be focusing on just trying to line everything up in that 90-degree upright head right position, because everybody's a little bit different. Malformations of the condyles, the atlas, the axis can leave people's heads a little tilted one way or the other, and that's normal for them. So once we confirm the position of the subluxation on the X-ray, at that point, what you want to do is establish what's called your heat pattern. So spinal thermography was originally developed back in the 1920s. A lot of chiropractors are shocked to hear it's been out that long, but before the computer generation, of course, there was referred to as the thermocouple spinal thermography. The instrument that B.J. Palmer had developed back in the 20s was referred to as the neurocalometer. The idea was that anytime you had a subluxation, the pressure produced upon the spinal nerves or the spinal cord produced excess heat, kind of like when you have an electrical short. So in an electrical circuit, anytime that circuit is broken or interfered with, the point of interference gives off extra heat. This can be scientifically measured with an electric meter. The human spine is pretty similar. So when we have a subluxation in the spine, it's going to produce heat at that point. And throughout the 1920s, throughout the 1930s, this technology was developed into a very specific, very accurate science. And this was the test that was used in chiropractic to determine when an adjustment was needed and when an adjustment was not needed. It lets you know when you gave an adjustment. You could check afterwards, and it would let the chiropractor scientifically know, did the adjustment reduce pressure? Did it do nothing at all? Or was the adjustment so bad that it actually pushed the bone in the wrong place, causing more pressure, more interference at that point? This technology is really what led chiropractic in those first 20 years from just general, I'm going to say, general manipulation, into a more specific form of adjusting. Basically based off of the science that we had available to us, from x-rays at that point or spinographs to the thermography, which let us know exactly when an adjustment was needed. So spinal thermography is amazing technology, and it's not technique specific, which is what I love about it. But if it's applied properly, it will usually lead you to the right location.
Mm-hmm. And that's a perfect segue. Can you talk about the location in the upper cervical spine and what attracts you specifically to that? And then also just touch one more time on the lineage. You had mentioned B.J. Palmer was somebody that you had studied with. Can you also talk about some of your other influences in developing your technique, but also just developing your perspective and approach?
Absolutely. So what got me into this technique, first off, was the science. Before I even got into chiropractic, I was always a science-minded guy. Those are my favorite classes going back to like middle school years. I was really attracted to basically anything that had you can measure or you could scientifically prove. And when I got into chiropractic, a lot of the techniques I was introduced to early on really was just kind of feel for the tender spots or feel for the areas that I thought were out and just adjust them. What I loved about when I discovered B.J. Palmer's work was that he had actually gone through those phases in the early years of chiropractic, when there was no x-ray, no spinal thermography. It was just the chiropractor's hands, and they had to guess where they thought the subluxation was. So by the time they got to the 1930s, of course, they had 20 years of x-ray analysis behind them, about 10, 15 years of spinal thermography behind them. This is the science that led chiropractic to the upper cervical spine as the one definitive causative place for where subluxation actually could exist. Prior to this time period, the big problem medical doctors had with chiropractors in regards towards the theory of subluxation in those early years were that they looked at the spine and they said, there's no way of subluxation to what you guys think can happen. And, D.D. Palmer, of course, went against it. That's how we got started. B.J. Palmer kind of promulgated that through the early years, that even though we didn't have the science behind it, we knew there was a subluxation somewhere in the spine. So by the time we got to the 1930s, everything led B.J. Palmer to the upper cervical spine. The anatomy alone showed that those interlocking facet joints would not allow what we believed was a subluxation to actually occur at, say, let's say T6, right? Those interlocking facet joints of the thoracic spine are so tightly locked up. What we thought was a subluxation, there was really a compensatory misalignment. You can't truly have spinal cord pressure or nerve pressure on those IVF areas because those joints are so tightly interlocked, going all the way down to the lowest lumbar and the sacrum. Basically, it was spinal thermography in the end that led B.J. Palmer to the upper cervical spine, again, as that specific cause. They were finding that when they were adjusting the upper cervical spine and not touching anything else, so they would, establish a heat pattern on a patient, use that heat pattern as the reference point for, yes, this patient needs to be adjusted or no, and then adjust only when that heat pattern would present itself, and only in the upper cervical spine. They would check the whole spine afterwards and find all these readings would clear up, and sick people were getting well. So basically, the science of all the research that B.J. Palmer did for us led us to the upper cervical spine. And we went from a full spine general approach of not knowing where to adjust by just guessing. And, occasionally we got sick people well, like B.J. Palmer said, in those early years. But as the science of our profession developed, we were adjusting in less and less places. From the full spine years, I think B.J. Palmer was adjusting maybe 2, maybe 3 segments. Then when we went to upper cervical exclusive, it was 1 segment, maybe once a month or so. So the work that we did went from being very general, very guesswork, adjusting 24 vertebrae every day, down to 1 vertebra, knowing when to adjust it, knowing how to adjust it, and when to leave it alone. Because that's when sick people get well. It's not adjusting that subluxation every day. It's adjusting it, setting it, and then letting innate intelligence from that point doing the job for us. And that's what I love about this technique. It is the science of chiropractic to a T. And research to us, as B.J. Palmer says, he went scientific with a vengeance for us during these years. So we know that we basically have some of the best techniques available to us in locating and correcting subluxation.
Can you talk about the law of cause and effect, and if you are truly able to find that cause of that which is interfering with somebody's ability to express full health, or which is the cause of that which they're having trouble with or challenged by in life? Can you just talk about the physical, mental, maybe emotional impacts of the subluxation and how adjusting it and clearing that has been able to change somebody's life in your practice?
Absolutely. It's my pleasure because this is what I get to see on a daily basis. It's amazing work what we get to do. So let's talk about the law of cause and effect. So the law of cause and effect says that for every effect, there must be a cause. There may be one cause, there may be one effect, there may be one cause or many effects to that one cause. The medical approach up until today is still treating the effects. Very few can treat the cause. I believe the only time B.J. Palmer accredited medicine to treating the cause is in certain cases of surgery. Other than that, when you take the medical approach towards pharmacopoeia, it's treating the effects. So the law of cause and effect as applied towards chiropractic is focused around subluxation. When we have a subluxation in the spine, it will cause pressure on the spinal cord or the spinal nerves. And this interferes with, physically speaking, the transmission of electrical energy from the brain, where it's produced, down the spinal cord, which acts like the conduit, and out to the spinal nerves, innervating every tissue of the body. This is the normal and the natural state for the human body. As long as there's no interference to this transmission of electrical energy, the body remains well, the body remains healthy, and it functions on its normal par basis. Now, we have a subluxation in the spine. This can be caused by 3 different factors. The most common is the physical factor: slips, falls, quick twists or wrenches of the spine, straining, anything that you can think of pretty much. Second, we have the emotional or the mental aspect, what we're going to refer to as the stress aspect, something that can occur on a daily basis for people. This has a cumulative effect on the spine and, of course, on the nervous system, which eventually can cause a subluxation. And then last, of course, is the toxic effect that we're going to see predominantly in today's society from medications or other poisons that people introduce into their bodies. Either way, it's going to cause the same effect upon the nervous system. It decreases that nervous system's ability to transmit electrical life energy from the brain down to the body. And whatever nerves become affected, that part of the body that they connect to or innervate doesn't function properly. This is what chiropractic refers to as dis-ease. If something's not functioning properly as a result of lack of quantity energy to that body. And the goal of the chiropractor is not to find the effect and not to worry about the effect, because there's nothing we can physically do for that effect as a chiropractor. As a chiropractor, what makes us stand out? The reason we're here and we offer a service to mankind, because we are the only healthcare profession that focuses on the causative effect, the subluxation. Using the tools that we have, from x-rays to spinal thermography, we can exactly locate where that causative subluxation is. And if we can locate where the cause is, we can give our best attempt through the adjustment in fixing that cause. And if we can fix that cause, the effects associated to that cause will begin to clear up in time. Now, the amount of time that it takes for those effects to clear up are going to be related to a few factors. First, how old that patient is. If they come to you when they're a child, when they have issues, they have a much better chance of getting well than when they're 88 years old coming to you. Second, how long they've had that condition and how severe that condition is. If it just started last week, well, it hasn't had that much time to grow and develop, has it? So as we adjust the causative subluxation, innate can more readily get to work of repairing damaged body tissues. Now, if they've had that subluxation in their spine for 20 years, innate's going to take a bit more time. Now, the last factor on the patient's side is going to be permanent damage, any kind of permanent damage to their body. So if the organ, the gland, the tissue that's become affected by that subluxation has some level of permanent damage to it, there's only so much that innate can do with that damaged organ. Innate is only limited by the matter in which it resides. So if that matter is damaged and it's beyond the point of physical repair, innate's only going to be able to work with what it's given at that point.
What is your sort of statement on summing up a person who's in high school right now or college? I recognize you have many kids that are growing and developing and will one day soon be at that age where they have to decide which direction they want to go on in their life and what purpose they want to choose. Can you maybe just send a message if you were speaking to the teenage version of them, or even the version of them that was in their 20s or 30s and in a career that wasn't fulfilling and looking for a path of purpose? Like, how can you maybe attract them into this profession, or really just build some context in their mind of why they should strongly consider becoming a chiropractor, maybe in a way that was more detailed than what your dad said? Maybe it's that simple.
Yeah,
though. Maybe
absolutely.
It's about keeping it simple.
I actually believe it's what you just said at the end right there. It's different people are going to be attracted to different things. And when it comes to chiropractic, you know, I've seen all sorts of people in the profession, as I'm sure you have as well. You know, you have the intellectuals, which I can really connect with. You have, you know, the opposite side, which is kind of the feeling-based chiropractors, which are really good people as well. If you keep the message simple, just like when we keep it to our patients, I find that people who don't know anything about this profession can more readily connect to it. You know, as much as I'd like to go to a high school or, you know, kind of a pre-ceremony chiropractic for people thinking of getting into the profession like I got into and read green books to them, it's over their head at that point. They don't know the context of it. So I'd say for people that are interested into getting into this profession, you have to ask yourself, are you truly a people person? Do you want to serve people? And do you want to help people on a level that nobody else can? The greatest mystery in this world has been, why do people get sick? We have been searching for that question for thousands of years of human existence. And it took somebody in 1895 to make that proclamation of what makes us sick. And it took his son to determine where that sickness was coming from. So for me personally, I love helping sick people. because when you're sick with, regardless of whatever your condition is, you can't be yourself. You can't enjoy your quality of life at that point. So whatever you love doing, you're not going to be able to do that because you're sick. So if you love helping people, not just so much because they're sick and you want to help them get well, but you want to actually help them restore the quality of their life. You want to help a runner get back out there and do 5Ks. You want to help a guy who runs a bank be able to run a bank without having to call out sick all the time. You're the go-to person for your community. The reason your community continues to revolve and function at its best is because they're subluxation free. And nobody else in the healthcare community can do what we do. So each day when I get to drive to my office from my house, I have about a 25-minute drive. And I know so many of my patients, where they live, where they work, I get to drive by their places of business on the way here and say, hey, that's where Mr. Jones works. Because he's subluxation free, he can do his job so much better. Or, that's where Miss Sally lives over there. She's got 4 kids. Because she's subluxation free, she can be the mom that she needs to be and take care of the household. I love what I do so much because nobody else does it. And it's a passion and it's a pleasure for me to be able to do what I do. And it's truly an honor. So I asked anybody who can reach down into their heart, into their innate intelligence. And if their innate in their heart is telling them that you need to help people and you have a passion within you to do so, chiropractic is really the best avenue to do so. It's the only drug-free, surgery-free approach to helping sick people get well and actually get results. That's the coolest thing about what we do. When you apply it properly, 9 times out of 10, you're going to get amazing results. That's still to continue to amaze me today, 12 years into practice now.
Mm-hmm. Mm-hmm. Proof is in the pudding. I appreciate your message this morning. It's very, very clear, very, very simple, and also you went deep there with how somebody can go about training if they're interested in studying thermography and X-ray analysis, and also the art of knee, chest, upper cervical work. I want to thank you for your time, and I hope you have a beautiful day in practice today. It sounds like you're going to be serving today, so can you just leave us with a last message of just anything that's in your heart right now?
Absolutely. For those who are interested in this technique, learn more about spinal thermography, X-ray analysis. My specialty, of course, is the upper cervical spine. I teach a knee, chest, upper cervical technique that I've developed as of last year called Knee Chest Specific Chiropractic. You can find us on Facebook. We host seminars. We started our first one this year, had an awesome turnout from 4 different chiropractic colleges. So check us out online, find out when the next seminar is, and you can come on out and learn how to find subluxation the way BJ Palmer did, and get sick people well as well. And last thing as well, for those who are interested in the Green Books, these are one of my passions as well. These are the Green Books series, of course, written by BJ Palmer and a lot of his faculty. I started a podcast called the Green Book Commentaries. You can find us on Facebook as well. And we are reading from volume 25 right now, my most favorite chiropractic green book, the most scientific one, of course. So look forward to seeing a lot of people there, and hopefully we can help more sick people get well with an amazing technique that BJ Palmer handed down to us. Thank you again, Dr. Ben. It's been an absolute pleasure, sir.
Absolutely. Thank you. Yeah, no, that's great to hear that there's resources that you're developing and sharing, and hopefully we can collaborate in the future on you creating something in the context that you're developing training in for the pre-Chiro student, because I believe the longer the runway is, or the bigger the trajectory, we can really shorten that learning curve and improve the future generation's ability to grasp onto the resources available to them that they're interested in and really go further with it. So thank you.
I look forward to doing that as well. Thank you again, Dr. Ben.
Absolutely.
Take care.
You too. Take care.